Good morning, ladies and gentlemen. This is Aisha Shehi, a health coach from the National Health Insurance Company, Daman, and I am part of the disease management team. Thank you for joining us today in Breast Cancer Awareness Webinar. Breast Cancer Awareness Month is observed every year in October by health experts, health advocates, and the public to raise awareness and support those who are affected by breast cancer. In today's webinar, we are going to shed light on one of the most common types of cancer that affects women, which is breast cancer. On a side note, please note that you can send your questions through the Q&A chat box anytime during the presentation, and we will allocate 15 minutes at the end of the session to answer these questions. It's our pleasure to have with us today Dr. Lamia Ahmed, our presenter for today from Abu Dhabi Public Health Centre. She is Senior Officer at Cancer Prevention and Control Section, Public Health and Research Department. Dr. Lamia, welcome. The floor is yours.
Thank you, Aisha. Thank you, Daman. And I'm very happy to be today with you guys, talking about a very important topic. It's not only in October, it should be an every month topic because it's one of the top diseases, which is like being a very important challenge in Abu Dhabi, UAE, and the whole globe. I will be talking about breast cancer awareness, but I will be happy all the time.
Yes, doctor, please share your screen.
Yeah, I'm going to share it because the chat is blocking. Can you see my screen? Can you see my screen?
Yes, doctor, we can see your screen.
Okay, so we will be speaking about breast cancer, and I always like to hear from you all the time what you think about cancer, what you know about breast cancer. So I prepared just a little bit questions, and that I would like to hear from you. There's nothing right or wrong. It's very important that we share information and we correct whatever wrong information that we have, because lots of the time we have information coming through the social media, some different websites, some different people saying this is found to be causing cancer and all these things. So please share with me your opinion. Is breast cancer a contagious disease? Is it I can get it from someone if they have it? So I just want anyone to answer, and there is nothing, as I mentioned, wrong or right. It's sharing information, correcting information. So is breast cancer contagious? Is it infectious that we can get it from someone?
Our audience, you can put your answers in the Q&A box.
Anyone answer?
Yes, someone said no.
It's true. So breast cancer is not a contagious disease. I cannot get it from someone. It's kind of mutation happens to the cell body, and we will talk about it later. If I don't have a family history of breast cancer, I won't get breast cancer. So is it true or false? Is this information right? That people who get breast cancer are only people who have family history?
Also, the answer is no.
Yes. So breast cancer, like family history, is only like 10% of breast cancer. 90% of people get breast cancer due to external factors which lead to DNA mutation. So underarm deodorants can cause breast cancer. Is it true or false? Because always people say, okay, don't use this antiperspirant because it causes cancer. So is it true or false?
Also, our audience says it's false.
Yeah, it's right. So there is no studies showed that this underarm deodorant cause cancer. And most of the time, how do we know that those things cause cancer or not cause cancer? Through studies. So there is a lot of universities and big institutes which do studies and research and tell us what causes cancer, what doesn't cause cancer. Some information comes through the social media and they say, Dr. So-and-so, he said this is causing cancer. No, we have to go to the proper websites and get the information. Should be scientific based and on research based. Consuming too much sugar causes breast cancer. So there is a lot of messages say that, okay, cancer cells they grow on sugar. And if you cut sugar from them, you will cut cancer. So is it true?
Also, the answer for that from the audience is false.
Yeah, because sugar can make like people obese indirectly. If you eat too much sugar, you can gain weight, and unhealthy diets and gain overweight can lead to cancer, but it doesn't have a direct connection with sugar. Wearing a black bra can cause breast cancer. People say that if you are wearing a black bra or a bra with the iron wire, it can cause cancer. So is it true?
Also, it's false.
Yeah, it's false. There is no studies showed that it's right. So to speak about breast cancer, why everybody is talking about breast cancer? Is it a real problem? Yes, it is a real problem. The statistics show that about more than 2 million, it's approximately 3 million, they were diagnosed with breast cancer, and more than 500,000 of this is what's caused by breast cancer worldwide due to worldwide statistics. Every 15 seconds, a woman is diagnosed with breast cancer somewhere. And every 50 seconds, a woman dies with breast cancer somewhere. So it's really a problem, and we're really losing lives because of breast cancer. That's why we need to increase awareness. We need to talk about it in October, September, November, the whole year. We need to talk about breast cancer. Yes, we celebrated on October, but the usual thing and the thing that we need to know, we have to know the right information. We have to know the facts. We have to take care of ourselves the whole year, not only in October. In UAE, the breast cancer considered the most common cancer among all cancer. It's #1 cancer. Breast cancer is the first leading cause of death among women in UAE and the Emirate of Abu Dhabi. So there is a high incidence and high prevalence of breast cancer worldwide and in UAE also. That's why we give all this attention and we say thank you to Daman, because they are arranging these workshops and awareness sessions yearly. It's really a great effort, and it's really a great initiatives from the team, Aisha and Asil and the whole team. So it's very important information to know that breast cancer can be survived. People can be going back to life if even they have breast cancer. In 2020, the WHO said that there is 7.8 million women alive who were diagnosed with breast cancer in the past 5 years, making it world's most prevalent cancer. Improvements in survival began in the 1980s in countries with early detection programs, combined with different modes of treatment to eradicate invasive disease. Here in Abu Dhabi in 2007, most of the cases used to come at stage 64% of the cases used to come at stage 4. But now we are lucky that only 16% of the cases come at a later stage because of these events, because of knowledge, because of spreading awareness, because we talk always about cancer. It's not that scary world. Everybody celebrate the pink color because it's not scary. It's becoming changing the face of cancer. So it's very important that we spread awareness and we talk to people about the disease. It's not something that is taboo anymore, or it's not a shame anymore. People before were ashamed to be diagnosed with cancer because they think that they did something wrong and it was a punishment from God, or they will be running in their families, and if people know about that they have breast cancer, nobody will marry from the family. These were all myths and wrong information, which now corrected by such awareness sessions and such awareness initiatives. To speak about the breast cancer, we have to know the anatomy of the breast itself. What is the function of the breast? Why God created this breast? It's a gland. It's a mammary gland called. It's something like a milk manufacturer, which God created to nourish the kids, the newborns. So the mammals mean that the animals which have breast. So the breast composed of fatty tissue, the yellow part that you can see, it's just fatty tissue. Inside there is the part of the cells that manufacture milk in this gland, which is called the whole thing called the mammary gland. But these are the ducts from where the milk goes, and this is the loops where the lobules where the milk is formed. So the milk is formed here, and it passes through the ducts to outside. The cancer doesn't happen on the fatty tissue. It happens inside the tissue of the breast itself, where the milk is manufactured. So it's very important that to know that the main function of the breast is breastfeeding, is feeding the babies. Many breast changes occur over the woman's life because there is a lot of hormonal changes before puberty and the estrogen. When the estrogen comes, the breast starts growing and the woman goes into the puberty time. And when the woman is pregnant, the breast change because there is a hormone called estrogen. This estrogen hormone make the breast ready to manufacture the milk. So the changes in the hormone between the menstruation, puberty, and having pregnancy, these are all changes make the breast more susceptible to have any kind of gene mutation. So usually the mutation happen in the smallest part of the body, which is called the cell composed of nuclear. In the middle of this nuclear, there is a DNA, and I think all of you know what's the DNA. So can someone tell me what's the DNA? Because we usually talk about, we do tests to know whether this is the father of this baby or not. So what is the DNA? Any answers?
We still don't have answer.
Mm-hmm. So the DNA is a part of the cell which is responsible of carrying our genetics. The color of our hair, the color of our skin, the color of our eyes. So this is one of the part of the cell carrying all our genetics, behaviors, and look. And at the same time, this DNA is responsible of the division of the cell. Usually when we are growing, our cells divide normally to make us taller, to make us bigger, to renew the cells. If we have a wound, the cells are renewed through the division of the cell. In the case of cancer, a mutation or something wrong happened to this DNA, so the DNA starts multiplying and dividing without a control till it forms the lump. And these cells, which is abnormal and which is growing very fast and having the blood from other cells, they have the ability to invade other cells. This is the difference between having a benign lump or abnormal or cancer lump. The tumor or the lump, which is a cancer, It can go from one place to another. That's why you can find the cells of the breast traveling through the lymph nodes to underarm pit, and from the underarm to the bones and to everywhere on the body. That's why we call it malignant cells or cancer cells. That's why, because they move from their places and they invade other cells. That's why we call it a cancer or tumor. But a normal lump, it will stay in its place and it will never grow, or it can grow, but it's never going to outside the cell. So breast cancer, as I said, it's a disease where cells in the breast tissue divide and grow without normal control. Breast cancers occur as a result of gene mutation. Most breast cancers are spontaneous gene mutations. Only 5 to 10% are due to inherited gene mutations. There are many inherited genes related to breast cancer. The most famous one is the BRCA1 and BRCA2. And I always ask a question. Have you heard about one of the actors that have these BRCA genes? Have you heard about one of the celebrities? Everybody knows about her, that she found out that she had a BRCA1 and 2 mutation of cancer. Did you hear about her? Anyone knows? Who is she? Any answer, Aisha?
No, still no answers.
There is a celebrity, she's very famous, and they know that she came to know that she had this gene mutation. She inherited it from her mother.
Yeah, someone's saying Angelina Jolie.
Yes, yeah, she's Angelina Jolie, and she had mastectomy. She removed her both breasts, and she had construction. And now, most of the time, when we talk about breast cancer, before, women were scared that they will lose part of their body. They don't want to know that they have cancer. They will lose their hair. But I think now with cosmetics and breast surgeries, there is a lot of plastic surgeries ongoing without a need. So in case of women have a breast cancer, she can have breast reconstruction even during the operation itself. When they remove her breast, they can do the reconstruction and put part of her body, can be from her tummy. They can take part of the abdominal muscle and make construction of a new breast. So it's not scary anymore, and the disease is not one of the things that women are afraid of anymore. So to talk about breast cancer, why we're making this awareness, why we are doing these sessions, why we're talking about breast cancer, because early detection is the most important and the key word for the whole thing about breast cancer. Breast cancer is starting as a very small, tiny cells like this one, which we call it a stage 0. It is inside the ducts, which I showed you, either the ducts or the lobules, the part of the breast, which is having tissue. So if it started like this, imagine, and it's found by a mammogram, it can be removed easily. And the woman will go back to her normal life. And survival will be like 99%, 99%. At this stage also, it is small and it can be removed. But you see that the more the cancer is left, it will start growing and growing till it becomes something cannot be controlled. And as I said, it will spread to other organs, to the bones, to the brain, to the lungs, to the underarm. So it will be very difficult to be treated and to be removed. But at these stages, it's very easy that the cancer can be removed, and even the margins around it where there is cancer cells can be removed, and the woman can go back to normal life. So this is the important thing about the whole awareness sessions and about talking about cancer and trying to spread the knowledge and the information. If you come from this awareness session by only this information, this is what we want you to know. Early detection of cancer means survival and means going back to normal life. So this is, as I mentioned, like it's stage 0, 100% survival rate. If it's stage 1, it goes less, 98. If it's stage 2, it goes less, 93. If it's stage 3 and stage 4, the chances will be very low. So the whole idea about the awareness is early detection. Early detection means that people go to back to normal life. They will survive cancer as if it didn't happen. I have known survivors for like more than 20 years now. And all the time, whenever it's October, they send me their names with their survival year. And the first time they celebrated the 5 years, they were very happy that they passed the difficult time and the high risk because they completed 5 years. And now they are survivors more than 20 years. I have known them. They are living a happily life with their families and enjoying their lives. So what does it mean? How can I prevent cancer? There is breast cancer risk factors, which everybody can control and can change. We call them modifiable risk factors. So the modifiable risk factors is never having children or having your first child after the age of 35. We encourage every woman when they got married, have your first baby. Don't take contraceptive and say that I have to study, I have to work. This is not good or healthy, because pregnancy have protection for your breast 9 months, because your breast will be off estrogen for 9 months. So this will be like a natural protection to your body. So if you get married, have your first baby as early as possible. Currently or recently using combined estrogen and progesterone hormonal replacement, HRT. The hormonal replacement usually is used in women after menopause. So it showed that it had the risk of causing breast cancer. And the women, the older they get, they have more chances of getting breast cancer. Current or recent use of birth controls bill. So if you use birth control, try to see your doctor and not to use it continuously. Sometimes discontinue, use other things, natural things, and go back to your control pills. But it should be always with the advice of a doctor. No breastfeeding. They said it's having a high risk of having breast cancer. A diet rich in fat or red meat and poor in fiber and fruits. This is one of the risk factors of causing breast cancer. Physical inactivity and overweight or obesity, smoking and drinking alcohol. These are all, we call them modifiable risk factors. So you can change them. You can stop them. But the second unmodifiable risk factor is being a woman. Every woman is at a risk of having breast cancer. Getting older, the more we get older, our cells are more susceptible to have the mutation. Having an inherited mutation, BRCA1 and BRCA2, family history of breast cancer. These are things which are not modifiable, but we can see that how we can prevent breast cancer in these cases. A personal history of breast or ovarian cancer. Women are having breast cancer, ovarian cancer are at risk of having breast cancer. Dense breast, which means there's a lot of cells on the breast. It doesn't mean that the big breast. Having previous biopsy showing hyperplasia. If there is any abnormality on a biopsy, that means a woman should follow closely. All those women are having non-modifiable risk factors, but it doesn't mean that they will have cancer. It's only called risk. You are at a risk. So the risk means that you have to take care more of yourself. You have to do more tests. You have to see your doctor more than a normal risk person. So what are the breast cancer symptoms? There's so many symptoms, but if you have any symptoms, don't panic, don't be afraid, because it might be something normal. So if there is a hardening in the breast, so the breast normally your breast is soft, but if all of a sudden you felt that the breast is so hard, it's something new. Puckering of the breast, that part of the breast have been pulled inside. Skin erosion, redness or heat in the breast. A strange fluid coming, most of the time coming from one breast. Dimpling, inside lump, orange peel skin. So the skin of the breast look like an orange. new asymmetry. So your breast usually is not symmetrical, but if this asymmetry increase, and you find that your breast is looking abnormal completely. Nipple retraction. So the nipple, some people, they have their nipples inside already, but if all of a sudden one of the nipples went inside, growing vein, a lot of vein, which is not normal, something that you didn't notice before, and a bump. So all these things can be normal, but the only person can tell you this is normal or not normal is your doctor. Don't ask your friend, don't ask your mom, because usually your friend and your mother always will tell you this is normal, don't be scared. No, you have to take it serious till the doctor tell you that this is normal. So this is why we're making all this awareness, why we're talking about breast cancer. We want to know the risk factors. We want to know the signs and symptoms. If there is anything wrong, you have to see the doctors. And honestly, in 3 of my lectures for the previous years, there is 3 ladies which found that they have abnormalities. And after the lecture, they went and they called me and they said that they found early cancers. So I always believe on awareness session and sharing information. It's very important that we always talk about it. And if you go from here and you go home, talk to your family about it. If you have your mother, your friends, and anyone, tell them about breast cancer, because it's very important that they know about it. You can save life. So how we can detect cancer early? Our recommendation as Abu Dhabi Public Health Centre that women should do monthly checkups. We don't call it self-checkup, we call it self-awareness. Because every month, if you stand in the mirror and you look at your breast, you can know your body very well. If any change happens, you will be the first one to notice. It's knowing your body. Stand and in the shower, touch your tips with your tips of your fingers all around your breast in circular type. And if there is anything abnormal, you see your doctor. Most of the time in the beginning, you will feel that there is a lot of lumps because you are just getting to know your body. This is not something to be scared of. We are talking about something that is new. You didn't notice before. So do clinical breast examination every 3 years at least, starting from the age of 20. And if you are 40, do it yearly. All women age 40 plus should undertake a screening mammogram every 2 years. Today, there is so many places that give a mammogram for free because of the awareness of October, Pink October. There is so many, there's mobile clinics, there is all over Saha clinics. Some hospitals, they are giving the screening for free. And for DICA holders, it's all already free. You can go at any time and do the mammogram. So how to prevent breast cancer? Adopt a healthy lifestyle. We saw in the beginning of Daman advertisement video that they're talking about having a healthy lifestyle. Exercise doesn't mean that you have to go to a gym. You need to walk every day. Fast walking, that you feel that your heart is working. Breastfeeding is very important. Having a healthy diet. If you're smoking, shisha, mudwah, whatever you're smoking, stop it, quit smoking. Avoid hormones as much as possible. Regular exercise. It's a very important thing that you take care of your health, take care of yourself. Now people are doing a lot of surgeries unnecessary. No, you can make modification that leads to a healthy lifestyle and a good look. You don't need to do surgery or bypass or gastric band, all those things. You don't need it. If you do modifications and changes, you will look better and you will reduce the risk of breast cancer. Remember, if any change is found, most changes are harmless, but they still need to be checked. Don't ignore them. A doctor needs to determine if there is a problem or not. It's very important. This is a take-home message for you. So does men get cancer? Yes, men get breast cancer, but only 1%. But at the same time, if they have family histories, because in pedigree, in family, if there is a disease or there is something wrong with the family, usually we have chromosomes from both parents. You have chromosome from your mother, and you have a chromosome from your father. But if both have a recessive gene, and this marriage get to have two genes, recessive genes together, so 25% of the kids will have the disease. Because two recessive genes means that it should appear. We advise people with family history from both sides to do genetic testing and make sure that there is no problem with them. The second thing, we advise men to support women to do the screening. You ask your wife to go and do the screening. You encourage her. Don't tell her this is all nonsense. Don't scare yourself. No. Encourage her to do the mammogram, to do the clinical exams, and to take care of herself. So how to support breast cancer patients? Breast cancer is a disease that affects the whole family. And support for affected women is very important and needed. There is a group of support groups at this website, but at the same time, we have to know that the psychological and the mental well-being of a woman with breast cancer is very important. She should be supported, not to feel she's alone, not to be scared, not to think that it's a deadly sentence. If you know a breast cancer survivor at work, at home, neighbor, you always give them their support because they need this to fight cancer. Their immune system will get better when you support them and they have a good mood and they have a happy mood and they have a reason to live. Their body will fight cancer. And if they don't believe that cancer is a death sentence, they will survive it. We have a list of Abu Dhabi registered breast cancer screening providers: Saha, Mubadara, DBS Healthcare Group, NMC, and Mediclinic. These are the centers which is for Thirqa holders. The screening is for free. As I mentioned that Saha now, they're having the services for free, so you can enjoy a free mammogram for this month. My take-home message for all of you: have a healthy lifestyle, know your risk factors, modifiable and non-modifiable, do regular breast screening, know your body and see your doctor for any changes. Love yourself. You have to take care of yourself. In your 40th birthday, go and do your checkups. You always be sure about yourself and about your health. It's a priority for you. Nobody will tell you go and check yourself. Never. We have seen in our life, we are the center of our family. We take care of our kids, our husbands, and we take care of everybody. We are hard worker at work. We care about your business, work, success, career, all these things. We give it a priority, but we never give our health a priority. My take-home message: we love you. We want you to take care of yourself. And thank you. I hope that you benefit from this awareness session. And if you have any question, I'm ready. And even after the session, if you want to send me, you can have my email from Asil all the time. Thank you, Aisha and the team.
Thank you, Dr. Lamia, for such an informative presentation, really. Now we will be moving to the Q&A section. We have a couple of questions here. So our first question, Doctor, at which stage does chemotherapy become necessary?
So there is
Doctor, you are muted.
Yeah, I'm trying to.
Yes, we can hear you now.
You can hear me now?
Yes, I can hear you.
Yeah.
Yes.
So what I'm saying about chemotherapy. So there always in breast cancer, there is the three models of treatment: surgery, chemotherapy, and radiation. It's according to the stage. Sometimes if the lump is very big and the doctor wants to remove it, sometimes he gives the chemotherapy or he gives the radiation first. He gives the chemotherapy first. The chemotherapy will make the lump shrink. So sometimes if they want to do the surgery, they give the chemotherapy before the treatment to make the lump smaller, and then they do the surgery and remove the lump. So it's always according to the case and the stage most of the time. They go according to the stage and the case and how much the cancer is spread. All these things are factors to decide what kind of modality of the treatment the doctor will use.
And are women with fibrocystic breasts more susceptible to get breast cancer?
So if there is any kind of fibrosis or a change, or like sometimes there is a fluid. Sometimes it didn't inside there is a fluid inside a cyst. We say this is normal, but usually if there is any kind of a change, the doctor will have the screening more than a regular one. He can have it in the beginning every 6 months, and then if it's not growing and it's not changing, he can make it like the span is longer. So not all the time those kind of changes change to cancer, but it needs to be in the beginning monitored closely, and if it's not changing, not increasing, the doctor will tell the woman to go back to normal screening.
And yes, doctor, regarding screening and testing, are there tests to check if a person has BRCA gene or has a high possibility of getting diagnosed in the future?
Yes. The genetic testing, which they take either blood or swab, and they send it to the lab to see that if they have those, it's a simple test. It's not something that invasive or they would take part of the cells. No, either focal cavity swab or blood test, and then they will find out if the woman is having this BRCA1 and BRCA2. Most of the time, it's done to the people that having the disease running in the family. So we always advise them at the age of 35, they do the genetic testing.
Moving forward to our next question, doctor. Is it possible to have breast cancer despite following these? So I'm assuming this asking about the modifiable risk factors. So if someone is following a healthy diet and exercising, so is it possible that they might get breast cancer in the future?
It's always there is a possibility of everything. So you have a healthy lifestyle, you exercise, you reduce your risk. It doesn't mean that you stop cancer. You reduce the risk. If you do all these things, you reduce your risk by, say, 80% that you can get breast cancer. But still there is a chance of 20% that we need you to do the regular screening for. Because I can do all these things, but at the same time, I have to do the regular screening to make sure there is nothing. If something happened according to something that I don't know, it will be detected early and it can be cured and treated at the same time. So our advice also always, we say primary prevention by having a healthy lifestyle and secondary prevention by having a regular screening. Those are two ways to stop cancer and beat cancer.
Clear. And how can you do the self-test if you had augmentation surgery?
So if you have an implant, it's difficult. If you do your regular self-examination, but we prefer that you go to a doctor and do the test with a doctor, because most of the time, sometimes they can do ultrasound, sometimes they can do the mammogram, because if the cells of the body is pushed to the back, it will be very difficult that you feel it. Because if you put an implant, the implant will push the real cells to the back. So it's very difficult for the woman to check it, but we prefer that she go to a doctor and do either an ultrasound or do the mammogram. With the mammogram, everything can be seen. So regular screening is very important.
And after having done surgery in stage 1 or 2, is it necessary to do chemotherapy as well?
As I mentioned, that it's the decision is for the doctor. If the doctor thinks that she should have 6 cycles of the chemotherapy, she should go for that, because it's always upon the test itself. Sometimes if they do they take the biopsy and they put the cells under the microscope and they find that it's a very invasive type of cancer, she should have what the doctor decides. The doctor will decide that she have a chemotherapy, she have a radiation. If he find that those kind of cells is very aggressive and can problem. So most of the time the treatment differ from one woman to another according to the type of cancer and to age of the age of the woman itself. There's so many factors. So it's very important that they follow the doctor advice all the time and make sure that they don't stop the treatment and go abroad and come back, and like this kind of shopping and disruption of the treatment is risky.
On that topic, doctor, if someone got breast cancer and was treated, what are the chances of breast cancer returning again?
So as I mentioned, that it's very important that the 5 years survival, like we advise the women that they follow up regularly, they take their treatment as it is. They at the same time have a healthy lifestyle, exercise, eat, make sure that you are always in a good and optimistic mood. Help yourself. So the 5 years survival is always the measure that we make sure that it's the chances is becoming less. The more that when the 5 years survival pass, we consider that the risk is becoming very minimal.
And someone in the audience is inquiring, I am an obese woman with more than 45 BMI. I notice a lump between my left breast and armpit since 4 or 5 years, and I think it's required to go for do you think it's required to go for screening? And suggest, as I am already 35 years old and she does not have kids.
Okay, no, I think you have different risks. Yeah, weight, and not having babies, and I think this is all risks that I advise you. Yes, go and do ultrasound. In your age, they will do an ultrasound. They will not do a mammogram, and make sure that there is nothing, because the more the risks, we advise that the women go earlier to the screening. So just see a doctor, female doctor, and ask for that you feel that there's something wrong and you need to have an ultrasound.
And how fast does breast cancer spread?
So as I mentioned, that it's according to the age and according to the risk. Because in younger age, because if you like remember in the beginning, I was talking about the hormones and the hormone change. Estrogen is one of the hormones that leads to having this kind of mutation on the breast. And one of the risk factors, if the girls go to puberty at the age of 9, that means they have estrogen for a long time. So estrogen is one of the factors that can increase the risk. So if the cancer come at a younger age and it is estrogen positive, the cancer cell will be very aggressive and it will go very fast, faster than the normal. But in older age, the cancer grow slower because most of the women at menopause or before menopause, the hormone will be very light in the body, and it's like preparing to menopause. So the younger the age, the more aggressive is the cancer. It can spread in 1 year or 2 years. But in the older age, and if it's not estrogen positive, it will be slower. So according to the case, yeah.
Yeah, and doctor, regarding the non-modifiable risk factor, if there is a strong family history of breast cancer, what is the right age to start screening and how frequent it should be?
So at the age of 35, we advise that women go and see a specialized doctor and they talk about their risk factors. And they like in the SKMC and in different hospitals, they can do the genetic testing for them, and they will see if they have the BRCA1 and the BRCA2. If they have the BRCA1 and the BRCA2 genes, they might advise them to remove their breast and have constructions, which is I think it's a very good thing, because women honestly they will get better look than they will have before. If she already have her babies and already she feels that she doesn't have more babies, and at the same time, if she's gonna have babies and she feels that she's at risk, she can like give them milk from outside. Her health is more important than to risk herself. So this decision will be taken between her and the doctor if they will find that she had these genetic mutations.
And doctor, Is it a possibility if someone got cancer, any type of cancer, it's not a breast cancer, previously and was treated, it's like, is it a bigger, is it there is a high possibility that they might also acquire breast cancer or any type of cancer in the future?
The most connected together is breast and ovarian. If a woman have ovarian cancer, the chances of having breast is more, and vice versa. But other cancers, most of the time, it's not related directly to breast cancer. Colon cancer, unless you know that they have this kind of running on genetic mutations and problems. But otherwise, no. Breast cancer is connected more to ovarian cancer.
And what kind of nipple discharge should we be aware of?
So sometimes if they discharge from both nipples, sometimes people have this kind of estrogen hormone in the body which produce milk. This is sometimes normal, but they need to see the doctor to treat them if they have extra estrogen in their bodies and they always have milk coming from their bodies. This needs treatment. But a discharge which is like not white, it's a little bit, the color is changed, and most of the time it sometimes with blood, and it is from one breast. Most of the time it's not both breasts. This kind of discharge that we advise that women go for checkup. Yeah.
And doctor, can someone be on stage 4 but does not experience any symptoms?
Most of the time, the cancer, breast cancer or cancer in general, doesn't have any kind of pain sometimes. But sometimes inflammation can happen. The redness, the inflammation. Sometimes the woman goes to the doctor and they give them like antibiotic. Most of the time, sometimes if they are breastfeeding after having babies and they have inflammation in one breast, and they go to the doctor different times and they have antibiotic, and this inflammation does not subside, they should immediately go to see a specialist to make sure there is nothing wrong. Because if you have different type of antibiotics and you feel that it's still you are not okay, this is one of the things. But the cancer, when it is advanced, the woman will have like really clear changes. Part of it is the under armpit lymph nodes is swelling. So most of the time, the changes will be very obvious at the late stage.
And does breast implants increase the chances of getting breast cancer?
Unfortunately, no. The studies did not show that the implants will increase the chances, but it might make it difficult to see the cancer cells. But no, it doesn't increase the chances. Unfortunately, I wanted to say yes to women to stop them, but no.
If the breast heterogeneously dense, does that mean the woman is in any stage of cancer?
No, because this is the nature of the body, the nature of the body. But if, as I said, it's not the fat. If it's having a lot of fats outside, because the cancer cell doesn't come from the fats. But if she have inside a lot of this kind of cells, she is at risk. It doesn't mean that she will have. Risk doesn't mean that they will have. Risk, that means chances are more than a normal person. But sometimes people have all these risk factors and they don't have any problem. And sometimes people doesn't have a risk and they have this breast cancer.
And does breast cancer treatments affect women fertility?
Yes, it does. And all the time that we advise a woman when she goes into plan, most of the time women take the chemo and they don't know that they might have chances of infertility. Yeah, so women should talk to the doctors regarding having their ovaries, because most of the time that women feel stressed and feel scared because of the cancer, they don't discuss all the elements. And this is their rights. The doctors should discuss with them. But if the doctor doesn't discuss, now you have the right knowledge and information all the time before you go into any treatment. Make sure that you make yourself aware what are the risks and the chances that you will have from this treatment. So one of it, infertility, the doctor can take these eggs or ova and freeze it until the woman needs it. Even for men, they do the same. If the men have cancer, they take the sperms and they freeze it for them until they need it. So the first thing, it's very important that you talk to the doctor about that.
And doctor, our last question for today, is there a link between oral contraceptives and breast cancer?
It have a chance if you use it for a long time without advice, following advices from a doctor. So women, most of the time, they bring these pills and they take it without. No, it's a hormone by the end of the day. So it's very important that you follow with the doctor if you're using any medication, and you have to have your frequent test more if you are using this contraceptive. And we prefer that you make sure that it's a saver. You can use natural contraceptive sometimes, and sometimes use the pills, not all the time, but yeah.
Thank you, doctor, for your input and for the presentation. Really, it's one of the most concerns women face here in our country.
Thank you so much, Aisha, for all your efforts, and really, you're doing a great job by doing that to those women.
Thank you, doctor. Dear audience, this is the end of our webinar. Thank you for joining us today, and special thanks to Dr. Lamia for her valuable input. Looking forward to meeting you all at our upcoming webinars. Stay safe and enjoy the rest of the day.